Hi Ben, can you introduce yourself and tell me a little bit about your experience as a pharmacist? Hi, I'm Ben Wilson, and I have been a pharmacist for over 10 years. I have experience working in both community and hospital settings and have developed a strong passion for the field of pharmacy. That's great. Can you tell me a little more about your experience working in these different settings? Of course. I started my career working in a community pharmacy, where I was responsible for dispensing medications, counseling patients on their medications, and managing the pharmacy's inventory. After a few years, I decided to transition to a hospital setting, where I was able to work more closely with healthcare providers, to manage patients' medication therapies and ensure their safety. Impressive. What do you think is the most important quality for a pharmacist to have? In my opinion, the most important quality for a pharmacist is attention to detail. As pharmacists, we are responsible for ensuring that patients receive the right medication, in the right dose, at the right time. A single mistake can have serious consequences, so it's important to be meticulous in our work. That's a great point. What do you think sets you apart from other pharmacists? I think what sets me apart is my strong communication skills. As a pharmacist, I understand that patients may have questions or concerns about their medications, and it's important to be able to communicate with them effectively to address these issues. I also pride myself on my ability to work collaboratively with other healthcare professionals to ensure that patients receive the best possible care. Excellent. What are some of the challenges that you've faced as a pharmacist, and how have you overcome them? One of the biggest challenges I've faced as a pharmacist is the constantly evolving healthcare landscape. New medications and treatment options are constantly being developed, and it's important to stay up to date on the latest research and guidelines. I've overcome this challenge by participating in continuing education programs and staying active in professional organizations. Well, it's clear that you're passionate about your work and have a wealth of experience in the field. Thanks for taking the time to introduce yourself, Ben. No problem at all. If you have any other questions or need any advice about medications or healthcare, feel free to ask me anytime. That's what I'm here for. Before closing up the conversation, I would love to ask you one last question. If anyone wants to pursue to become a pharmacist, what kind of education is needed? To become a pharmacist, you need to have a Doctor of Pharmacy (PharmD) degree, which typically takes 4 years to complete, after completing a bachelor's degree. During those 4 years, you study topics such as pharmacology, medicinal chemistry, and patient care, and complete a number of hands-on clinical rotations in a variety of healthcare settings. After graduating, you also need to pass a licensing exam to become a licensed pharmacist. Thank you so much for your valuable time.